But without further ado, we'll bring up University of Virginia.
Hi, I guess I'll start. My name is Jeff Jenkins. I'm the Residency Program Director at UVA, and I'm accompanied this evening by two of our fine young Chief Residents, Dr. Glenn Sapp and Dr. Justin Tu. I'm just going to hang back, honestly, and just be available for any specific questions that I can answer. I'm the Residency Program Director in my 11th year, so I've been around a while, but these guys are living the dream here in our residency program, and I think they're best equipped to tell you all about it. So without further ado, Dr. Sapp, are you ready to go with your slides?
Yep, give me just a moment to share my presentation. You guys are going to be able to see our other chief resident, Dr. Tu, who's also on here. So if you want to introduce yourself while I pull up the presentation.
Yo, what's up, guys? Hey, Justin Tu. As lovely introduced by Dr. Jenkins, yeah, one of the chief residents, 4 of us total, but a couple of us now on video right now.
All right, so let me go ahead and get the presentation ready. All right, my name's Dr. Sapp. I'm one of the 4 chief residents at University of Virginia, representing the Physical Medicine Rehabilitation Program. I'm excited to talk with you guys. So grateful that PM&R Scholars was able to put this together, especially now more than ever. You know, we need involvement, engagement in the residents, in the students, and faculty as well, given everything that's happening right now in the world. So thank you guys for joining and staying this late, especially on the East Coast. All right, feel free to ask questions in the chat. Dr. Tu is going to be able to answer them at the end of the presentation. So we're going to start with contents. We're going to discuss who we are, our curriculum, extracurricular activities, our alumni, and where we are. So starting off with who we are, we're a smaller program. We have 12 residents that span through the PGY 2, 3, and 4 years. So that comes out to 4 residents a year. For me, this is one of the things that actually drew me to the program. I knew going through our residency, you know, it's going to be a grind at certain parts, and I definitely wanted a program where I could fall back and talk with my co-residents about anything, get to know everyone, and just, you know, have a program of, you know, a tight-knit family, as everyone else has been saying as well. We have 2 categorical intern PGY1 positions, and we're going to go through that in just a little bit, their curriculum. That doesn't exclude anyone who wants to apply to our, you know, awesome UVA internal medicine prelim years or the UVA general surgery prelim years as well. And then for our department, we have 14 PM&R departmental attendings. We have a physician certified in sports medicine. We have physician certified in spinal cord injury, traumatic or brain injury medicine, electrodiagnostics. We have fellowship trained, board certified pain physiatrists, specialists in ultrasound and regenerative medicine, as well as specialists in cancer rehabilitation as well. So here are some pictures of our awesome residents and faculty. In the center of the photo, we actually have a photo of our resident attending retreat that's annual. So you can see some residents mixed in with our faculty there. In the bottom left-hand corner, that's also one of our amazing faculty members, Dr. Ashley Geary, who's holding the camera up closest. And we have some residents as well. It looks like they're doing some awesome team bonding experience. Top left photo, we have some residents. Looks like they're bonding at our great Charlottesville restaurants that we have. And let's see, to the right-hand side of the photo of the page, we have one of the coverage opportunities there that has a mix of actually some nurses from clinic, medical students, residents, and our faculty. And we also have our sports medicine fellow there on the left-hand side as well. And then at the top right-hand corner, can't forget holiday party, gotta mention that. All right, so let's go ahead and move on to our curriculum. The PGY1 categorical spot is a categorical position that spans a lot of different departments at UVA. So you're gonna be housed at our large UVA. It's a trauma level 1 center. On the right-hand side of the screen, you can see the photo of the main hospital. And so you're gonna be spending time in the general medicine inpatient unit. You're gonna be spending 8 weeks on the general medicine floor and 4 weeks on the GI or digestive health medicine inpatient team as well. You're gonna be seeing patients on the neurology inpatient consult service for 8 and 4 weeks respectively. For me, these two things, I was able to do the categorical year and really felt prepared during my second year when we moved over into the inpatient part of the curriculum. I felt like I had a great differential for seeing patients, stroke patients that might have altered mental status, for seeing transplant patients that came through as well. So I felt like I had a great foundation during this categorical year. Also, we have some outpatient time in there as well. You spend time in the orthopedic spine clinic and the adult reconstructive clinic as well. And so that also helps out with, as we get into the PGY2 curriculum, you're gonna see we have a rotation on the joint and reconstructive unit. So knowing what orthopedic attendings prefer, knowing what some things they're looking for when they're seeing patients, very helpful. One of the draws for this categorical year for me was actually the idea that we do a month in the emergency department instead of an ICU month. For me, working in the emergency department, I learned things to help work up patients. When you're on call during PGY2, PGY3 year, and even PGY4 year, you're gonna have patients that are gonna have issues overnight when you're on call. You're gonna have patients on the floor that are gonna have issues. And so being able to have that month in the ED was a great experience. And so you can see in this, the picture we have on the left side is actually the brand new wing of the UVA Academic Center. The bottom levels are actually the brand new emergency department that they've recently built. The top floors are going to be another wing of the academic hospital, so they're going to have another floor there as well. We have the residents in this year go through the PM&R outpatient consults as well, and then a month on urology, inpatient, and outpatient also. A lot of people wonder why the month of urology, but when you're seeing patients with acute or chronic neurogenic bladder, such as on the spinal cord or traumatic brain injury unit, when you're seeing patients with obstructive issues, it's great to be able to have that foundation as well. Next, we're going to move over into the PGY2 curriculum. Historically for us, this has been an all inpatient year, but we have a responsive dynamic curriculum. And as residents, we wanted to actually change, and we wanted to experience more on the other side of rehab. We wanted to see more of the consult side and how patients come to us. So originally, we typically do 3 months of each of these blocks, 3 months of neuro, spinal cord injury, ortho, and 3 months typically of general rehabilitation, but that's been changed recently. And so now we do a month of inpatient consults. And so that's at our UVA Academic Hospital that you're going to be seeing patients there, figuring out, what are some appropriate diagnosis, appropriate indications for rehab, when should they go to other level of cares. And so that's one of the aspects of our dynamic responsive program. We're able to make that change. Our rotations are arranged in the PGY2 year as 6-week blocks. So a resident would go through 6 weeks of neuro, 6 weeks of spinal cord injury, 6 weeks of ortho, and then 4 weeks of general rehab paired up with 2 weeks of inpatient consults. And then you'll go back through those again to complete the year. Moving on to our location. So one thing I mentioned, enjoying, was the idea that we have a centralized location. Our hospital is Encompass Health Rehabilitation Hospital. It's a standalone unit. That's a 2-story, 50-bed rehab unit. And so you can see pictures of our rehab here as well. Next, we have actually some awesome photos I recently took. We have our rising PGY3s who are training our new PGY2s. This was actually taken last week. It looks like everyone's at morning huddle. So the normal interdisciplinary workflow that you'll get to know as a PM&R resident. Moving on to our next year, the PGY3 curriculum. One of the highlights of this year for PGY3s is we have 3 months of our PM&R musculoskeletal clinic, and that's with our departmental chair, Dr. Wilder, a big name in sports medicine, running medicine. You're going to be working with him, seeing MSK issues, seeing an active population, and trying to get them back into recovery. You're going to be seeing gait, biomechanic evaluations for patients. And during this time as well, you're on the rheumatology rotation on certain afternoons and prosthetic and orthotics clinic in certain afternoons as well. The other aspect of the musculoskeletal clinic rotation is during this timeline, you're going to be the point person for a local high school football team. You're going to be one of the providers on the sideline on Friday nights for the team. And as well, typically there's going to be Saturday race events. We have Charlottesville Marathon, half marathon, women's 4 mile, or several races that are going on in events. So you're going to be the point person, making sure there's enough personnel there working. You're going to be there on the sideline, or either manning the medical tent. So you're going to be directly in the thick of things. So whether it's fall or whether it's spring, there's going to be some event going on for everyone to get experience with. Next, during our PGY 3-year, we also have 3 months of electrodiagnostic medicine. Definitely one of the highlights of our program as well, with Dr. Jenkins, our program director, being the attending there. As a 3rd year, you're going to be the junior doing EMGs. You're going to learn the procedure, learn the basis of interpreting EMGs and neuroconduction studies. And typically our residents after 3 months have about 200 EMGs under their belt. For me, I'm actually coming off of that rotation. And so we had clinics closed down for COVID for about, I think it was like 5-6 weeks. So I was actually concerned that during that time, was I gonna be able to get my EMG numbers in? AB PM&R has a minimum of 150, but actually I'm ending that rotation now, and I've actually been able to make over 160 EMGs observed and performed in there. So definitely one of the highlights. During this year, you're gonna have 2 months of inpatient consults as well back at UVA at the main hospital. You have 1 month of general rehabilitation at our Encompass location. Residents go through a month of pain management. And so this is special if you're interested in pain medicine. You actually rotate through our anesthesiology department. You're gonna be working alongside fellows, doing procedures, lumbar interventions alongside the fellows and presenting those patients and learning from them. So this is a great experience. And then we have elective time as well during the 3rd year. I've heard some students actually ask about, do we have elective time, or do different programs have elective time throughout their curriculum? So for me, in my elective curriculum, my elective rotation, I spent a few weeks in our training room with our sports medicine, family medicine physicians, and sports medicine PM&R physicians. I got to experience ultrasound, a lot of procedures and injections in our regenerative medicine, with our regenerative medicine clinic attending. And then I also spent some time in the anatomy lab in certain mornings, working with the medical students, teaching them clinical correlates, things that are important, once you get into seeing patients, things to help solidify, what they were learning. So I was a teaching assistant for one of their courses. Here are some pictures of our PGY 3-year. In the top center, we have Dr. Gibson, our Director of Outpatient Clinics. On the left, we have our Speed Clinic, which is this is our formalized, highly technological gait biomechanics clinic. This is where you see patients are going to be having the light bulbs, the reflective bulbs, basically on different joints. They have a high-tech 3D camera array, so you can learn from the technicians, learn from the specialists there, how to recognize different gait issues, biomechanic issues. On the right-hand side of the screen, we have our Dr. Smith, who's our inpatient spinal cord attending. He also does a Botox and spasticity clinic as well. Here, he's actually teaching some medical students at this point from our School of Medicine PM&R interest group. And then moving into our PGY 4 year. So at this point, one of the highlights, PGY 4 year, is going to be 4 months of clinical elective time. This is great depending on what your interests are. You can rotate in our cancer clinic. If you're interested in pain medicine, then you can rotate through some of those clinics as well. Just a wide variety of things you can do. If you're interested in research, this is time where you can spend a month doing research, getting that under your belt. I personally plan on going back to the anatomy lab, doing some teaching with medical students, and doing some other rotations. Next, as a PGY 4, you have the 3 months as an EMG senior. At this point, you're going to be in the role of doing more interpretation for nerve conduction studies and EMGs. You're going to be help leading the studies, coming up with a differential, and writing out the impressions and findings for the patients. You also have 2 months of pediatric rehabilitation or UVA Children's Hospital, where you're working in multidisciplinary and specialty clinics. We have a month of occupational medicine, where residents are learning techniques in manual medicine, impairment ratings. Residents are learning how to perform independent medical evaluations as well. We've had some of our residents do moonlighting, where they're doing some of these evaluations also. So that's a possibility. We have a month of interventional spine. This PGY 4 month of interventional spine is actually different. This one, you're working with one of our fellowship trained interventional physiatrists, doing injections, seeing patients in clinic. And then we have an outpatient orthopedics month, where you get to choose which orthopedics clinic you'd like to work in and who you'd like to learn from during that month. Some of the extracurricular activities, I already mentioned some of these. Coverage opportunities, we have multiple local high school teams. While you're on the musculoskeletal rotation, you're going to be the point person and the main provider for one of these high school teams. There's attending available for you, whether it's in person or a phone call. There's typically a senior and a junior resident. You can also get to know the athletic trainers, learn from them as well. You'll be talking with coaches, seeing high school athletes, during injuries, after the games. We also have community races and marathons that I mentioned as well. And what's notable is our attendings are open to finding opportunities. We actually have a resident who's a former wrestler who's interested in getting involved in some of the high school wrestling meets. And so we have some attendings who are interested in working those also. We have ultrasound courses as well. One of them where we have the upperclassmen teach the course for junior residents. We have biannual meetings with the PM&R interest group from the School of Medicine, and also anatomy lab sessions where you can actually teach medical students. But we also have a fall anatomy lab curriculum where we go to the anatomy lab and we learn directly from the cadavers. And then in addition, one of our pain physiatrists also holds an interventional spine course in the fall. That's a 6-week course taught by Dr. Grice. He's one of our board certified fellowship trained interventionalists. And so you can actually see in some of the photos we have on the bottom right-hand side, that's in the anatomy lab where they actually let us bring one of the fluoro machines down there, and we were able to practice under Dr. Grice's supervision, different procedures. Bottom left-hand photos, we have Dr. Smith again with some of the ultrasound courses. In the middle left, that's one of our didactics that we have, where we actually have one of our specialists in regenerative medicine and ultrasound teach us different techniques, and that's during our didactics as well. The rest of the photos are from some of our coverage opportunities that you can see there. Moving into didactics and research, we have daily didactics at noon. It's protected time, and so they're arranged by monthly topics. You can see the monthly didactics that we have, including radiology round, journal club. Bradham club is where residents take turns going through a chapter in Bradham club, presenting it, and also be from Cucarillo as well. We have ultrasound lectures and essay reviews. In terms of research, we have resident initiated and faculty supervised opportunities. So we've actually had former residents who were MD, PhD residents who have done projects. We have several case report opportunities. If you're interested in original research, we have faculty that are interested in working with you, guiding alongside you. And then in terms of stipend for traveling, training, conference opportunities, we have up to a $2,000 stipend for that. And then moving on to alumni, when you start a residency program, you want to also look and see, what are the residents who are graduating before you, where are they going? And so we have lots of residents, typically about 50% of the graduating class is going into fellowships. We have lots of sports medicine fellowships that people are going into that you can see here. But we also have people going into other specialties. 2 years ago, we had a resident go into pediatric rehabilitation at Johns Hopkins. He spent some time doing electives in the pediatrics department that we have. We also had a fellow this past year. You can see on the right-hand side of the screen, our most recent class of graduates. We miss them so much. One of them went into spinal cord injury fellowships at the University of Utah. Another one went into interventional spine at Emory. And then we have lots of graduates that go into private practice and academic physiatry positions. All right, so what are our strengths? Let's kind of summarize some of these things I've already talked about. Our overall curriculum allows for a choice and elected time to pursue interest and specialization for employment and fellowship. I'm currently right now in the middle of the sports medicine fellowship application. And so with all the elected time I've had, with all the amazing opportunities and coverage opportunities as well, I've been able to have a wide breadth of opportunities. I'm going to be able to list things from covering high school football teams to pre-participation physicals that we do yearly for multiple high schools. Lots of things that you want to, be engaged in, you're able to do. If you're interested in pain medicine, like I mentioned before, you're going to be working with the anesthesiology department and with our physiatrist as well. Next is we have ample opportunities for procedural trainings. I already highlighted some things like the EMG. We actually had a resident who was able to log, I believe it was 575 EMGs during her program time. And so that was an awesome thing. I've been able to get lots of ultrasound experience. And just right now, starting at PGY 4-year, I've been able to make all of my minimums at this point. So whether you're interested in ultrasound, interventional procedures, you're going to be able to get a wide breadth of opportunities. We have a responsive dynamic curriculum, and thanks to our smaller program, we're able to talk one-on-one with our faculty advisors. And lastly, we have great one-on-one mentorship. Whatever you're interested in, we're going to be able to find the attending to plug you in and make sure you get the opportunities. All right, and next we're gonna wrapping up the presentation. Thank you guys so much for staying on with us. You can follow us on Instagram at UVA PM&R. We're gonna be posting updates, ways you guys can stay in contact with us. I also included my email address here, GHS2R, and Dr. Tu is gonna speak answering any questions.